Welcome to Cradle and All, a podcast hosted by sisters Renita and Christine to educate, inspire, and connect with other mothers. Every other week, listen as we discuss topics related to pregnancy, raising children, and balancing motherhood with other aspects of womanhood. Whether you're relaxing, juggling tasks, or even breast pumping, join us as we figure it out together. Hi, everybody. Welcome back to another episode of Cradle and All. This is your host, Renita.
And this is Christine. Hey, everybody. Welcome back.
We are recording this in the summer. We are back from our vacations, and we hope you guys have been having a really great summer.
Yeah, I know I have.
Oh, yeah, for sure. As I'm getting ready for Jackson to start kindergarten soon. Oh,
I know. That is so exciting for him. He's going to love it. You're going to love it. It's going to be like a whole new world for y'all, for him to enter school.
So before we get into today's episode, we just want to thank all of you guys for listening, tuning in every other week, and supporting Cradle and All. So we are very excited for upcoming episodes in the next few weeks. To show us support, please consider subscribing to the podcast, but also writing a review and rating our podcast. This helps us to get more listeners so we can get out more information to you. So don't forget to subscribe and leave a review. Okay, let's get into it. Well, Christine and I have been talking a lot about following our gut as moms, and we've all been there where you need to make a decision that's right for you, even when everyone around you may not always think that's the case. And so that's what this episode is all about, which is just following your gut as a mother.
Mm-hmm. Yeah. I mean, I think that is one of the most important things. And one of the gifts that we get as moms is intuition. And I believe in it so strongly. I know it's spoken to me my whole life, but even more so as a mom when it comes to my kids. So I had to really listen to my intuition, trust my gut when it comes to some of the things my youngest son, Dakota, has been going through his whole life almost.
It's so interesting. I feel like I've mentioned this on the podcast before, but it took me a while to find confidence in listening to my gut. I thought I should listen to other people who have done this before or who know what they're doing, or listen to experts. But, you know, at the end of the day, no one's more of an expert than you as the parent. So I'm so excited to get into this talk today.
Yeah, me too. This has been something I've been really excited about this episode because this experience is just so close to home. It is literally happening in my home right now about, like I said, my son, Dakota, and what I've observed and learned and what we ultimately have gone through with him, which was related to his health. So we can jump right in.
Yes, let's do it.
Yeah.
All right. So Christine, tell us a little bit about what's been going on with Dakota and what's been happening where you felt like you needed to listen to your own intuition, even though maybe things around you were making it seem that you didn't need to.
Mm-hmm. Well, when Dakota was little, he's had a lot of things that I've noticed about him that were just kind of striking and alarming. Not initially alarming, but over time, observing these things made me realize that something might not be quite right. So, for example, when he was little, and my mom was the first person who noticed this, his feet were a little off. Of course, a baby starts walking. It's really, you're unsure of what's right, what's wrong. They're stumbling all over the place. Their feet are misplaced. They're tripping over their feet. And that was the case for him. He was constantly tripping and he was kind of stumbling a bit, even though he was an early walker, but the way he walked was a bit off.
Now, at this point, how old was he when you were noticing that?
So he started walking right at 12 months. He started walking. So he was, I would consider that kind of an early walker because by his first birthday, he was already standing and moving. Not all the time, but he was definitely mobile on his feet. So it wasn't until probably 13 months, once he had his footing under him a bit more, that mom actually started to notice that his foot, one of his feet or both of his feet looked like he was pigeon-toed, what we call pigeon-toed, or he had an in-toe. So he walked with his toes turning in. And as he continued walking, we noticed that it seemed like it was causing him to trip over his own feet. It took a while for me, honestly, I was not convinced that something was wrong because I just wrote it off as he's learning how to walk. He's still getting his feet under him. Everything's okay. But one of the biggest things that across his whole experience between that, his feet and also his, what turned out to be like an ENT related issue was observing. So really just taking the time to watch him over the course of several weeks, several months, and determining, is something actually going on, or is it just the way that he is? Maybe he's just a kid who walks like that, or maybe he's just a kid with a runny nose. Is it normal or is it not normal? And
I
so
remember,
yeah,
I remember you guys
Mhm.
talking about his foot being turned in. And honestly, I was like, he's a kid. Like,
Right.
I was like, mom, annoyed with mom. I was like, mom, stop picking on
know.
Christine or just stop being so particular. I just thought,
Right.
what are they talking about?
I remember that too, because I was like, yeah, she's right, mom. Just leave him alone. He's fine. And also, when somebody is critiquing your child, that can feel like an attack. I felt
Yeah.
attacked of like, leave him alone. He's fine. Sometimes something can actually be diagnosed and clinically wrong with your child that you actually need to get checked out, even though we think our little babies are perfect. Sometimes something can actually be off. So with Dakota, it really was a lot of observing the way he walks for a while.
Now, can you talk a little bit about, like obviously mom, me, those around us, we had our opinions, but when you were going to your pediatrician appointments, like, did they think anything?
So we did bring it up to the pediatrician. We started there after a while of observing him and hearing from mom that, look at his feet, look at his feet. When we brought it up to them, of course, they're going to observe to see if they notice anything. So they had him walk up and down the hall looking at his feet. And it was so subtle that everyone, even the pediatrician, said, we can see if it changes or if he grows out of it. Also, what I have found is because of the age of him, he's only 2 right now. So he's like almost 2.5. So at 2, not even almost 2.5, it's like 2 and 4 months. So at 2, he was, at this point, he's probably 1 and some change. And because he's so young, even they were like, we need to give it more time. We're not sure. We do see what you're talking about, but because of his age, there's really not much that can be done by other physicians. And so with that, it was like, wait. One thing they did recommend, though, was changing his shoes, doing some things with his footwear to change the way that he walks. They recommended like these Buster Brown shoes, these heavier shoes, putting his shoes on different feet to force him to walk straighter. That at that point, that was all that was recommended, was doing that. They did say, so that was the first appointment with his feet. Once we brought that to their attention, that's what we recommended. So of course we did what they said.
Now, did he seem bothered by it? Did he seem like he was having a hard time walking or it was holding him back?
It definitely wasn't holding him back at all. Like he still was active and moving. But as I continued to watch him and as he got older, I did notice more behaviors that seemed uncommon. Like, for example, he seemed to get more fatigued when walking. So if we would be walking from, let's say we went to a festival and we're walking around and we're holding his hand, walking with him, he would just like lose, his body weight would go limp and he would just let us drag him, or he would just sit on the floor or lay down. And I was like, why? At first I'm like, oh, he's just being silly. But this would constantly happen where I felt like I started to connect the pieces, like, well, maybe he's just getting tired. Maybe he's getting fatigued with walking. I didn't immediately think it was anything with his feet, but I thought that's not normal. Kids are usually full of energy, running up and down, playing, but he would start to just get tired and not want to walk at all anymore. Also, after we did make the change with the shoes, he still was tripping and falling a lot. So the more he walked, the more we noticed that his feet were turned in so much that he was tripping over his own feet. So whenever he's running, and this was even more so noticeable when our kids were all together, because when they're all running and playing, he's tripping every couple of steps, or every time he runs, he can't just run and without falling. So I would always kind of compare him and Russell when they're together, because I'm like, when your kid's by yourself, you think you can compare them maybe to siblings and you're like, okay, well, it's just him. But when he's in a group of 4 kids total, and he's clearly tripping and falling, and he has another kid who's younger than him that's doing just fine, I started to think, well, maybe something really is wrong with him. I don't know. But yeah, that's when I started to really question, when all the things to collectively, all those things together, it's like, well, you know what? Maybe we need to go see somebody about this.
What about Dontrell? What was he thinking? Were you guys talking about this together, or was he kind of like, nah, nothing
Yeah.
to worry about?
We did talk about it together, and it was really not a serious conversation. It was serious in the fact of like saying, oh my gosh, he keeps falling. Look at him. He's tripping, and saying, let's see what happens. But it was more so joking, like, well, I guess he's not going to play football, like joking about it's just going to be the way he is. He's just going to be tripping and falling. But, I think ultimately we both probably knew deep down that something's not right, especially when you have other kids and you know what their experience was like, and you can see your kid, you're like, I don't know. So yeah, so eventually after more months, I think we went back to the doctor for another like 6-month appointment. As they get old, they have those 6 months, 3 months
Like your
visits.
routine check, your routine.
Exactly. Yep. So we went to the routine check, and then we brought it up again saying that we did what you recommended. Nothing has changed. We think we need to see somebody now. And this is something that I really think every parent needs to do, is like fight for what you think is right. Like trust your gut. Cause I was like, we need a referral. We basically were saying we need to see somebody. We need a referral, because they weren't really pressed for that. They kept saying, well, you can see, and like, well, if you really want to, but he's still kind of young. We're like, no, 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 no. We need to see a specialist. We need to see somebody. So we ended up this was kind of, now this is the process that I think is can be frustrating sometimes, like the process of elimination, going to all the many specialists, trying to figure out getting to the root cause of an issue. And this is where it takes so long, where it can take long to like really get to the issue. Cause there's so many different specialty doctors. You go to your pediatrician, they're the generalists, but then you need to really go to all the specialists all over town to find out what's going on. So then we started down that journey.
Okay, so before you get into that journey, like how were you feeling at this point? Were you feeling stressed out or anxious, or more kind of like, we'll see how it goes?
I was not, well, I mean, I think I'm always worried when things come to my kids, like always hopeful and kind of pessimistically optimistic, if that's even a thing. Like, oh my gosh, this is so scary. And then at the same time, it's like, well, everything's gonna be okay. It'll all be fine. We'll figure it out. Like, this is us figuring it out. So it's always that nervousness of, oh my gosh, what if it's really bad? Especially once you get down the Google rabbit hole. So starting down there, looking at foot issues, and then seeing, oh my gosh, does he have a neurological condition? Is it something that is muscular related? Is it an autoimmune related? Like all these different rabbit holes of, then I even start talking to John Troll, like, tell me about your childhood. Did you ever have this when you grew up? Asking my mom, like, Mom, did we ever do this and that? Like trying to really put the pieces together on your own.
Yeah. Yeah.
It could be a lot. So I think though, going to those specialists is the best route, even though it can seem kind of like a headache, but it also brings answers many times. It really is about the answers and the relief you're going to provide your kid.
So what specialist did you go to, and how did you know who to see?
Okay. So the pediatrician made a recommendation, but we decided to go with a different office because we wanted to go with a particular hospital system in Georgia that specializes in children.
And they made a recommendation for what kind of specialist?
They recommended a physical therapist. So we did go to the physical therapist. That's where we started. So we started there. And of course, he was still at this point, I think he maybe was, we went there to get an evaluation done. And this was when he wasn't even 2 years old yet. So he was like about to be 2 in a month. So we started there and got an evaluation done. And after the evaluation, they said, yep, we see what you're talking about. Here's what we have found. He has muscle weakness here. He had, they started listing out the things that they found with him. So it was something like he had muscle weakness. He had weak ankles. He has intone, like, towing. Yes, you are right. Basically, he does have something going on here, and he should come to us for services. So it's like, yay, okay, we are not crazy. We're right. He has something going on. It's like kind of a weird celebration of like, woohoo, but also, oh no, is he going to be okay?
Yeah.
So after that evaluation, I was like, okay, great. Let's start the services. Let's get going. So we then have to go to regular physical therapy with him, and with the goal being, we set goals, you start going so that he can improve. Keep in mind now, the physical therapy is a treatment, but it does not necessarily diagnose what's going on. It doesn't show you or tell us what the underlying condition is. So we start going to physical therapy. However, that wasn't the end of it. Because as we're going, the physical therapist, she's great, wonderful. She's asking us more questions about what is the condition? Do you know what is causing this? What is going on?
She asked you that?
Well, she didn't really, not in those exact words, but what she was saying is, yes, he can come, but we're working on helping strengthen what we see the weakness areas are, but they recommended that we go to other doctors still. The physical therapist did say that, like, you should go to neurology.
Yeah.
You should go here. You should go. So we're like, okay. So then we had to think like, wait a minute. We thought this was going to be it. Like this, y'all are going to fix him. He'll be fine. But then that kind of got the ball rolling. And then we started to realize and get recommendations from our physical therapist that we actually still need to figure out what's going on. So from there, that led us to neurology. So that's what happened. The doctor, she didn't recommend, she recommended that we go to a neurologist. She was like, you probably need to go to neurology to just rule out anything, to rule out a neurological condition. So we started, so now keep up with the timeline. We start with the physical therapy. Then from there, it's like, okay, now go to neurology. Neurology's next. Okay, so now we're like, all right, so now the worry and the fear starts to like peak even more. It's like neurology. Okay, back to Google. Wait a minute, what's going on? Neurological condition. Then it starts all the list of neurological conditions that show up when you Google what our son had with his feet and the muscles.
Yeah, I can imagine how scary that was.
Yeah, you remember because I was talking to you about it too, of like, oh my gosh. And
I'm one of the people that you needed to block out because I was like, it's probably not that big. I mean, it's not that big a deal, but I just was kind of saying, maybe just don't worry. I was trying to make you feel better and say it's nothing, like it's just his foot, but you just ignore me, keep going. Well, honestly.
And mom again is on the other shoulder saying like, you need to go. You're not acting quick enough. You need to go now. What are you waiting for? And she's like, I think you're dragging your feet. She was like making me feel really bad. Yeah, really, no pun intended. But she was like, you really need to go. I think you're like letting the fear stop you from making these appointments. And I mean, maybe she had a point. I actually was scared. I did not want to hear some bad news. So I was like, yeah, we know we need to make an appointment. We're going to.
Yeah.
I mean, it is scary to not know what you're about to find out. And it could be something that could be life altering for the whole family.
Yeah. So how long does it take you to even get in with these specialists?
That can vary, for us, for some of them with PT, that was pretty quick. That didn't take very long at all to get in, probably a month. With neurology, that appointment was made probably 3 weeks out, but we called several places. So the thing is, you can go, like in Georgia, you can go with a hospital system who has probably every specialty doctor there, like a Kaiser type of thing in other states. But in Georgia, like for us, we wanted the soonest available. So we would call several places that we found just to get the soonest available appointment. Because for us, it was like, we want answers now. We don't want him to continue. We don't even know if he's in discomfort. He's not at this age. He can't communicate as, not talking, saying, Mom, my foot hurts or my throat, whatever. So we're like, we need answers. So we called a couple of places and we made a short list and called them all to see who we can get in with the quickest. Actually, for many of these specialists that we ended up going to, we had several appointments on the books and just went there. And then depending on how that one went, we would cancel or go to the other one. And we'd also call our insurance and be like, hey, would you cover this if we went to 2 specialists? So, I mean,
so there's a lot of legwork on y'all's end.
Yes, it's a lot of legwork. I mean, thankfully, if you have like 30 minutes in the day, you can get this done for a couple of days. It can seem daunting at first, but once you get the ball rolling, I think like your momentum and desire to have answers will push you forward. But yeah, it is a lot of steps. It's not like you just go on one website, at least for me, and click and there it is. It's like you have to put in the legwork to get to make these appointments, to go to the appointments, and to like follow up with the doctors too after the appointments and the pediatrician, get everybody kind of collaborating on the same page for your child's health.
Yeah.
Yes. So we went to the neurologist, the first appointment that we made, and thankfully they said that there is no neurological condition. But from there, the neurologist recommended another specialty doctor that we go to. So now he's on to his third specialist for his feet. This was a orthopedic pediatrician. So now for the orthopedic pediatrician, we go there, and actually at the neurologist, he recommended that. And he was saying like, oh, you should have started there first. So it seems like we went in the backwards order. We should have started with the orthopedic, then went to neurology, then went to physical therapy, but we did the other order. Mm-hmm. So with the orthopedic doctor, that is when they looked at his feet, did x-rays, and really observed his muscles, and then determined that he needed to wear braces on his feet to correct his walking. So
did they give him a diagnosis?
They did say he had some term. Don't even ask me what it is, because I don't know, but it's
idiopathic hypotonia.
Oh yeah. Yes, that's it. And what does that mean?
Basically, he's got low tone of that area of his foot and ankle. Idiopathic's the medical term for, we don't know why, basically. There's no known reason for the low tone in his foot.
Mm-hmm. Which is not very satisfying, but it's like, yes, here's what's wrong, but you don't know.
But it may be, I mean, I can't speak for you, but do you feel a sense of relief to know that this is something that they have an answer for what to do, as opposed to we don't know what it is, or it could be something worse?
Oh yeah, this is definitely probably one of the better outcomes that there could have been, because there was something we could do about it. It can be treated, and it can potentially be cured. And it's not something that's debilitating and life-threatening either. So that's great. Mm-hmm. So yeah, I was happy with that. And I was happy that we have a solution. So he is wearing the braces now. It's something where he has to keep them on 8 hours a day. And it basically is the point is to strengthen his weakened muscles in his ankle. And eventually the goal is that the muscles are strengthened enough to where his feet are corrected and he no longer needs to wear the brace. But there's no telling how long or how quickly that can take. They, of course, can go based on like historically, this is what happened, these are trends, but we'll see how it goes for him. So he's wearing them, and it's like, it doesn't change his quality of life. He's still running and playing. And honestly, we feel like he's getting better. Like,
good.
Yeah. He's not falling anymore.
Wow.
And also, so he's got the braces, and he also is going to physical therapy. So in combination of these things, I feel like we're doing all that we can to set him up for like complete recovery, like complete straight feet.
Well, that's good, especially when you go through the whole motions of not knowing what's going on and it takes so long to find an answer. Mm-hmm. It can be reassuring to realize, okay, now we have an answer and a plan.
Right. And that all happened in the span of 5 months. That's 5 to 6 months. I mean, honestly, I was about to say that's not long.
Oh, I mean, to me, that seems like a long time of worry. For me as a mom, I'm a worrier. So that seems like a long time to me.
Okay. Well, let me correct that. We noticed the feet, of course, when he was not even 1. I was talking about once we actually went to the doctors from the time we went to the first evaluation until we got the boot on his feet and had answers, that was 5 to 6 months.
Okay. Yeah. Wow.
But the time leading up to that was much longer. So yeah, I mean, the answers do help. And I think that was much of a better experience for us in terms of getting a resolution, having answers, compared to the ENT issues that he also has.
Yeah. So what's going on with his ENT issues?
So what started out as just a runny nose, which kids all have runny noses at some point. I mean, Jackson had a runny nose he still does, kind of a stuffy nose.
Stuffy all the time.
Right. Every kid has a runny nose, and every doctor will tell you, oh, they're in daycare, or, oh, this or that. There's like so many reasons why they can have a runny nose. And for many parents, that is the reason, or that is enough. for you to be like, okay, well, it'll stop when he's in kindergarten. I heard that a lot. It'll stop when he goes to kindergarten. I think pediatricians all say that. Once he's exposed, it'll stop. May or may not be true. But with Dakota, it was like he had a constant runny nose that never, ever, ever stopped from the time he was born, literally. If you can even imagine that, a newborn with a runny nose. He was a very juicy kid with a lot of saliva, fluids. Like literally the day he was born, he choked on his own saliva so much so that we had to like press that emergency button to get somebody in the room and like basically like
suction him, deep suction
him. But I think honestly that was the very beginning, and we always tie it back to that was the beginning. We should have known then, because the juiciness. I really do think that had something to do with his ENT issues even back then. Seriously. So either way, so he just was always very runny and juicy, and of course that's very normal. But when the runniness never stopped, that's what gave us the red flags. We did what the doctor recommended as far as give them these medications, Benadryl, Zyrtec, this and that, all the things that were appropriate for his age, Benadryl, all these things. We did it all. Nothing ever worked. And we're thinking like, well, why do they keep recommending this if it's not working? Why is it not working? Is something else going on? So again, paying attention, observing, knowing your little one, like just noticing what seems normal and what doesn't seem normal.
So when you mentioned it to your pediatrician that his nose is always runny, what kind of stuff did they say?
So what they did recommend were medications. They were very much, you need to medicate with these things, like try these different medications to dry him out. So that's what we did to start. We started with the whole medication route of let's dry him out. But you know what? That never worked. I mean, when you gave medicines to Jackson for his runny nose, did anything really work for him?
Yeah. I mean, he takes Zyrtec and Flonase at this point, and it's working. So,
okay.
And I remember like Dakota, no matter what, nose always running like a faucet.
Mm-hmm. I know, poor thing. He like his nose was always so raw from the runniness.
Yeah.
So we thought maybe it's something allergy related. So again, we brought it up to our pediatrician and said probably around, again, in the 1 year old, one of those visits in the 1 year old time frame, saying his nose is always running. Can we go see somebody? What can we do after we tried the medication route? They recommended an allergy specialist. So we started there. We went to the allergy specialist and they did that battery of tests that they can do on an infant or a toddler, a young toddler's arm to see if he's allergic to anything. He's not allergic to anything. So we're like, okay, great. So he's good. So we had no allergies that were revealed. Mm-hmm. So they recommended a daily, they said, well, he's not showing any allergies per se, but he could still have some seasonal related allergies. You should give him a daily round of nasal spray. And maybe also observe what you feed him. Maybe there's some food allergy that we didn't pick up on. So just see maybe there's something food related. So I did not really do the food thing. I'm not really good at that. I need to do better. Like I'm not really that observant when it comes to the foods and how it treats, how their bodies react to that. I know a lot of moms are, but I'm not. Are you?
I mean, not at all. My kids just inhale everything without me. Right. I turn around and the food's gone. So
right. And I don't remember. I'm like, I would need to track this. Like you ate cheese on this day. And then
it's hard with kids. They're snacking. If they are in daycare with other adults, then you may not always be able to see. So
right. Exactly. So I was like, okay, well, I don't know. I'm not going to do that. But we did do the nasal spray, which did not work either. Like we did what was approved. That didn't work. So then from there, it was, I mean, really at that point, I just didn't do anything for a while. I was also in the camp of, well, maybe it'll just stop. Maybe it'll stop. He doesn't have anything other than the runny nose. It's just the nose. Occasionally he would get nosebleeds, but it doesn't seem like anything else is going on. I don't know what changed in me. One day I just like something flipped.
I remember one day you were like, I Googled something about adenoids and he meets the criteria. Mm-hmm. Something about Google. I don't know what prompted you to Google that, but you were like,
right.
His voice is soft and his mouth is open or something like that.
Right. That is what prompted me. It was his speech. his speech is what finally made me think, okay, something might be going on with his nose, his throat, all this stuff. Because for a while, I was just like, okay, his nose will dry up. But then the more he started to talk, in that 2 to 3 year old period, the kids start to talk way, way more. And he was in that phase. He still is. So the more his voice developed, it sounded like something was caught in his throat, like he had a stuffy nose or a frog in his throat. And then, so compared to his peers, I would be hearing him talk, like compared to Russell and kids in his class, I was like, his voice is sounding weird. Like it's not clear. It sounds raspy and it just sounds muffled. I remember like specifically having a conversation with you about that too. And you're like, I don't think he sounds weird. Like he does.
I felt like my kids have very deep voices. And I remember when your oldest, Dallas, was younger, he had a very soft, fine voice. So hearing Dakota's voice, I felt like, oh, he just has a voice like his brother, is what my take on it is. Yes.
Oh my gosh. Well, for me, that wasn't even it. It was like the clarity of his voice, the tone of his voice sounded off, especially compared to Russell, whose voice is like piercingly clear.
Yeah. Oh, yeah.
Just
I woke up to that
clear.
voice today.
So that's what it was for me. I started to pick up on that and notice how he sounded. And I was like, something's going on. Why doesn't he sound clear? So then that's what really set me down a path of like, I need to figure this out. Like a dog with a bone. What is going on?
Yeah. So and you were looking all this stuff up. You were looking online, you were reading more about it. And you were like, I think he's got this and that. And you came to me and was like, I don't know even what to do at this point. And I was like, you should talk to your pediatrician and see what they recommend, see what they think.
Yes, you did recommend that. And I was like, okay, you're right. I do need to talk to them. But I did not talk to them right away. We got some advice from my husband's like a family friend who worked at an ENT place, and she said, oh, it's probably adenoids. So at that point, that's when I started to look down the path of adenoids and stuff like that. So then it was like, okay, we need answers. So this was in May, honestly. This was just May of this year.
About 2 months
going
ago.
Down this path. Yeah, 2 months ago. So at that point, it was again making these specialist appointments, starting with one and going down the list of all the ones until you get to the answers. So we started making appointments. We made an appointment with ENT. And again, that one took a very long time for pediatric ENT. I don't know what it is with ENT, but they're booked out months sometimes in advance. It's a very busy practice. So we made that appointment. We also made an appointment with a speech therapist, made an appointment with, what else did I do? Maybe that was it.
I think didn't you need an MRI?
That was for the ENT. Okay. So we started with the speech therapist because again, it was the way he talked that concerned me. So I thought maybe it's a delay. Maybe he needs to go to speech therapy. So got an evaluation for that and he did not qualify. They said, you know what? He's actually doing well. Your best bet is to go to ENT. So, okay, let's go to ENT. Had an ENT appointment, again, made several appointments, called around, made appointments to see what was the first available, finding people online, got in, went to ENT, and they did a hearing exam. And then they also looked in his ear, looked in his nose, all these things, asked this question. With the hearing exam, he actually failed several of the hearing tests and he had fluid in his ears. And they said, you know what? He probably needs hearing ear tubes, which apparently is a very common thing for kids that are between 18 months to 5 years old to have this because they have fluid on their ears, which is why some kids get a lot of ear infections or have hearing issues, swimmer's ear, different things that go on with their ears, inner ear issues. So they wanted him to come back just to see, is the fluid going to go away? Is it something that's still there? And then they also requested that he have an x-ray done of his nose and throat area to see if he had enlarged adenoids, tonsils. Because of course, my research, I was like, he has enlarged adenoids. He fits the bill. He's a mouth breather. He's got a runny nose. He talks weird, which isn't really a symptom. The breath is another issue. So Google was right because he does have enlarged adenoids.
And it took you pushing and doing the legwork to get the answers that you wanted.
Yeah, it did. I mean, it really did take just trusting myself and knowing that something was wrong, and then also making those appointments and following through and asking questions based on what I thought I knew from what I did research on. I also talked to his teachers because he's in daycare. So talking to other adults that are encountering him, asking them, do you notice anything wrong? Like, do you notice anything going on in class? Even talking to you and family members saying, what do you think about Dakota? Do you think something's going on here? So it really is a culmination of notes, like just like mental notes I took and conversations to determine we need to take this a little bit farther than just waiting for it to get better on its own.
Yeah. So now he's going to have his adenoids removed.
He is, yes. So he's going to have adenoid surgery in a couple of weeks. He's also going to get ear tubes. And I think I'm very happy about that. My husband and I were, and you were there when I got the news. Like, we are just so excited that we have answers and that hopefully it'll provide him with relief. Because like I said, like, we don't know what, I keep asking the doctors, like, is he in discomfort? Is he in pain? And my fear is that he just has been hearing the world muffled this whole time, thinking it's normal. And I just want him to like getting a pair of glasses for the first time, just to hear everything clearly, to breathe well, and just not be living in that kind of fog or haze that it might be providing him with.
Yeah. Well, I think this is going to be a nice way for you guys to feel like you've done your part as parents. And kids get things are going to come up. This is not going to be the last thing that one of our kids end up dealing with, but it just goes to show that you have to follow your gut. You have to go with your intuition. And even if you have people who say, oh, it's nothing to worry about, even if it is nothing to worry about, you have to do your due diligence. And I think that's the most important thing about it.
Yeah, because a lot of times there was nothing to worry about. We went to the allergy specialist. Oh, he has no allergies. Neurologist. Oh, there's nothing there. But at least you can rule that out and you can get to the heart. If there is something to get to the heart of, you can get to that much quicker. So it's so important. I think one of our biggest jobs as parents is to be your child's cheerleader, their advocate, their mouthpiece sometimes, especially when they're in that, 0 to 5-year-old age frame and maybe even elementary school, because they can't do it for themselves.
Yeah. Absolutely. And, there have been times, this takes me back to when Russell was in the NICU. There have been times where I wish I had spoken up when my gut was telling me to on little things. But hearing the story just makes me feel like, okay, it doesn't matter the situation. Moms are never wrong. Parents are never wrong when it comes to what they think is right, and just go with it.
Right. We always are right when it comes to our kids. And the thing is, when these doctors are working in a pediatric environment, they have to know that parents know best. At the end of the day, we are the parents. We know our kids. And I think hopefully this episode can assure all the parents out there that you really do know your kid and you have to advocate for them.
I mean, this is what I tell my own patients every day. Like, your body best. As a provider of any kind, whether it's your dentist, your pediatrician, your own doctor, you see them for a short period of time and they have a level of expertise, but you are the expert on your body and you know what's off, what's different. You're just like you're the expert on your children who cannot speak for themselves, or even as teenagers may not be developed enough to mentally talk about certain things. So you are the expert. And you are part of, if not one of the most important parts of that medical team. So you just did that right thing. You helped connect all the dots by going to all the right people, by going to the people who are surrounding Dakota, his teachers and family members, to all the doctors, until you got the answers that were necessary. And now he's going to get this situation figured out, both with the foot and with the adenoids and the tubes.
Poor thing. Yeah. I hope that this is the end of his health related issues for the rest of his life.
Well, it won't be, because we all, even adults, have health things, but making sure that you've got that support is key. So I love that you were able to, connect the dots for him. And even as he gets into adulthood himself, he'll be able to do those same things himself.
Right.
And it's scary going through it as a parent, because you don't want anything to be wrong with your kids. It's a scary part of it is comparing to see what other kids are doing, what's normal, what's not. I remember going through the stages of milestones where I was like, Dallas was talking way before Jackson. I was like, is Jackson ever going to talk? Or, there are different things that kids do. Is this one going to crawl when that one was crawling 3 weeks ago? So that comparison can always be there. And the fear of, does this mean something bigger than what I think it means, can be there.
I know.
But
so many questions and emotions. like, that's something I guess we didn't even really talk about or touch on, but the questioning, the emotions that you go through when your child has a health related issue, it can be a lot on a parent. Like, I know I have spent many nights online searching for answers, and not only answers about his health, but like answers on how to deal with things, trying to learn about other people who've gone through this and their advice on it from a mom perspective, and also for the kid. And also, like, I found myself sometimes I would just be sad. Like when I found out that he had to have surgery, when we actually booked the surgery a couple of days ago, I then was like very sad and telling my husband, like, I'm sad. I don't want him to go through this. And I just am sad. I don't want this for him. So it's just a lot for the mom and the dad too.
Yeah,
the parents.
It is. But, supporting each other and surrounding yourself around people who are going to support you is the best thing to do.
Mm-hmm. Yeah. And thankfully it's not that bad. So
yeah,
you
did it.
Yes, that'll be a future episode, is maybe following up on the surgery, how it went, kind of the outcomes of everything, because I know he's not the only one. Apparently this is very common. So there are probably other
common
parents. Yeah.
So common. When I see patients' medical history, I'm like, okay, what surgeries have you had? The two most common surgeries that I hear are tonsillectomy and adenoidectomy. So getting your tonsils and your adenoids removed. So It is so common.
Well, that's why I was wondering, like, some of these surgeries, why do we even have these organs? Why?
That's a whole other topic.
They could just be removed without any repercussions. Why?
Hello, evolution.
Yes. Okay.
Well, thank you for sharing this story about Dakota. I know can be tough, especially when you're reliving it and talking through some of the stressful parts, but also the victorious parts of feeling like you were able to be there for him, because that is amazing.
Right.
So
it is a win.
Yeah. And hopefully this can be inspirational to other parents. I know it definitely is for me every day.
Right. And so, and you just said Dakota's an evolved species.
Yes, he does not need those adenoids. He doesn't need I guess he needs his ears.
Yes, he needs his ears.
He doesn't need the fluid in his ears.
No. That's great. So the next generation after him will be even more evolved.
All right, you guys. Well, we will catch you in 2 weeks for the next episode. Thanks for joining us. See you next time.
Yep. Thanks, y'all.
Don't forget to subscribe to our podcast so you don't miss a thing, and leave us a review. You can also follow us on Instagram @thecradleandall, or email us at thecradleandall@gmail.com.